Oral health is a very important part of overall or general health. Problems with one's teeth or gums can lead to many other problems both physically and socially. We need to keep our mouths healthy, and one of the easiest ways to do so is by using fluoride. Fluoride helps our teeth stay healthy. Teeth are a living part of the body and are made of many different layers, including hard crystals, soft tissue, and blood vessels. On the outside of the tooth is a hard layer called enamel. The enamel is very important because it is our front line of defense for keeping out tooth decay. Tooth decay occurs when the bacteria that lives in everyone's mouth consumes sugars and starches from the foods that we eat. These bacteria then produce acid as waste products. The acid travels into the microscopic crystals of the enamel, and if fluoride is not present, can damage the tooth. This is called demineralization. The acid will continue this process if left unchecked and can enter the soft tissue underneath the tooth. These cavities allow for even more bacteria growth and can result in infection. Sometimes the infection turns into an abscess at the gum and can create other serious health problems. For example, a pregnant woman with gum infections may have an increased risk of delivering a low birth weight baby, and children who have bacterial infections in their mouths may have an elevated risk of heart disease and respiratory illness when they become adults.
The frustration we feel as pediatric dentists is that too often we see these children too late in the development of the caries process to do anything more than manage the resulting, often devastating disease.
Oral disease and cavities are the most common health problems for children in the United States. That's the bad news. The good news is that you can prevent these problems. Of course, the first step to oral health is toothbrushing and mouth cleaning. Using a toothpaste with fluoride is even more effective in preventing decay because the fluoride helps strengthen the tooth enamel. Fluoride helps prevent tooth decay by adhering to the microscopic crystals that make up the structure of the tooth. When fluoride adheres to the tooth crystals, it helps in two different ways. First, it helps the tooth defend against demineralization, or destruction of the tooth crystals. Second, when fluoride adheres to your teeth, it also helps to remineralize, or repair crystals that have been previously damaged by the bacteria's acid. Fluoride coats the enamel of the tooth and makes it harder for the acid to penetrate the enamel surface. Fluoride has been shown to reduce the incidence of tooth decay by as much as 40%. Fluoride is a natural defense against decay and bacteria. You can get fluoride from a variety of sources. If you do not live in an area where the water is fluoridated, you will need to look for other sources of fluoride.
The application of topical fluoride is a routine part of every preventive visit in our office. These are simple procedures that are appropriately administered by trained dental assistants and hygienists. The procedures are brushed-on fluoride application, fluoride foam or gel tray application, and the newest approach, fluoride varnish application. The traditional view of fluoride has been in its systemic uptake during the formation of teeth, typically through supplementation by prescription or through fluoridated water. Systemic fluoride has always been thought of to be of more importance than topical fluoride. However, more and more evidence is accumulating that shows, in fact, that topical effects may be of even more significance. There's an ongoing remineralization of enamel throughout life. Topical fluoride has proven to work and is clearly effective in the prevention of tooth decay and aiding in both tooth remineralization and the reversal of the caries process in the early stages of caries development. The application of fluoride has been a standard of care for many years, chiefly because it is cost-effective, efficient, and readily accepted by our patients.
One easy way to get fluoride is to make sure you are brushing and flossing your teeth and your children's teeth at least twice a day with a fluoridated toothpaste. Brush and floss your teeth and your child's teeth just before you and your children go to bed. Eat a balanced diet and limit the frequency of snacking. Most importantly, see your family dentist every 6 months. Start cleaning your child's teeth as soon as the first tooth appears. However, children under the age of 2 should not use a fluoride toothpaste unless their doctor or dentist have suggested it. Children over the age of 2 should only use a pea-size amount of fluoride toothpaste. Teach your child to spit out the toothpaste and to rinse after brushing. Young children who swallow excessive amounts of fluoride may develop white spots on their permanent teeth. These white spots are harmless cosmetic blemishes. So please, supervise your child's brushing. Only use a pea-size amount. If you have questions, be sure to ask your family dentist. You can also ask your family dentist about over-the-counter fluoride mouth rinses, professionally applied fluoride varnish, tablets, drops, and gels for people who have a higher risk of getting dental cavities. Used in the recommended amounts as shown here, fluoride can greatly reduce the risks of cavity, bacterial infection, and certain related health problems. Oral health is an important part of overall health, so keeping our teeth and our children's teeth healthy, bright, and strong is very important. Health starts here.